Hi, my name is Brad. I'm an active duty hospital corpsman. I'm going to teach you the proper procedure for the administration of blood products. This is done during the tactical field care phase when a casualty is in hemorrhagic shock and requires blood products. Intravenous and interosseous IVIO access is demonstrated in other instructional videos. So today we're going to go over the administration of blood products in accordance with Tactical Combat Casualty Care Guidelines. Consider body substance isolation. If a combat lifesaver is available, direct them to assist you. Before administering blood products, you should ensure that external hemorrhage is controlled, the IV or IO saline lock is in place and functioning properly, tranexamic acid, TXA, has been administered. Hypothermia prevention measures should begin during TXA administration. Secure appropriate blood products and a blood administration set, ensuring that the blood tubing has a filter. If you are using cold stored whole blood, an IV fluid warmer should be secured and set to infuse blood products at 38 degrees Celsius or 100.4 degrees Fahrenheit if possible. Close off tubing with roller clamps. If you are using Y tubing, be sure to close all the clamps. The Y tubing that is not connected to a bag will always remain clamped. Now peel back the port opening on the blood product bag, exposing the port. Remove the cap from the spike of the IV tubing and insert it into the blood product bag, pushing the spike to the hub. Turn the blood product bag right side up, release clamps, and observe the blood flowing through the line. Next, squeeze the drip chamber filter, ensuring it is filled halfway, and hang the blood bag above the casualty. If you are using the Y tubing, ensure that the line that is not attached to the blood remains clamped off. Release the distal clamp on the IV tubing, allowing blood flow to the end of the IV line, then clamp the line shut. If you are using a blood product warmer, connect the IV tubing in accordance with manufacturer's guidelines. Clean the saline lock with alcohol or povidone pad. Then secure the luer adapter of the IV blood line into the saline lock if you are using a luer lock set. Or place a 16 gauge needle on the end of the IV tubing and insert it into the saline lock if you are using a standard saline lock set. Release all clamps on the blood product line and begin transfusion. Secure the IV tubing to the casualty. The preferred resuscitation blood products of choice for casualties in order of precedence are cold stored low titer type O whole blood, pre-screened low titer type O fresh whole blood, plasma, red blood cells or RBCs, and platelets in a 1:1:1 ratio, plasma and RBCs in a 1:1 ratio, plasma or RBCs alone. Be sure to assess for and treat blood transfusion reactions, anaphylactic reaction, hives, itching, stridor, shortness of breath, and or hypotension. If your casualty has any of these symptoms, you should stop blood infusion, initiate normal saline or lactated ringers IV infusion, administer epinephrine 0.3 milliliters of 1:1000 intramuscular or IM, administer diphenhydramine 25 milligrams slow IV push or IM, monitor airway. If available, consider methylprednisone 10 to 40 milligram IV push over several minutes. Immediately find another compatible blood product or donor and repeat the transfusion. Acute hemolytic reaction, arm pain, chest pain, back pain, nausea, disseminated intravascular coagulation, and or fever. If your casualty has any one of these symptoms, you should stop blood infusion, initiate normal saline or lactated ringers IV infusion, administer diphenhydramine 25 milligrams slow IV push or IM, immediately find another compatible blood product or donor and repeat the transfusion. Administer 1 gram of calcium, 30 milliliters of 10% calcium gluconate, or 10 milliliters of 10% calcium chloride, IVIO, after the first unit of blood products. Continuously monitor the patient throughout administration of blood products. If the post-transfusion systolic blood pressure is less than 100 millimeters of mercury and the heart rate is over 100 beats per minute, then another unit of blood products should be administered. If another unit of blood product is given, continue to monitor the casualty for blood transfusion reactions.
Hey, you're gonna be good, man. We'll get this blood on you. Pretend-wise.
Be sure that discontinued blood products and used equipment is disposed of properly. And remember, document all treatment on a DD Form 1380 Teachable C casualty card and attach it to the casualty.